Recording. Cool. All righty. Hello, Dr. Oliphant. My name is student pharmacist Mason Jackson. I'm here to present a patient. His name is Mr. Samuel Jenkins. He's a 47-year-old male presenting on day 3 of an illness with fever, dry cough, nasal congestion, sore throat, myalgias, fatigue, and chills. He tested positive for both influenza A and COVID-19. For the background for this patient, he has a past medical history of hypertension, type 2 diabetes mellitus, obstructive sleep apnea, obesity, and hyperlipidemia, which are being treated with lisinopril, metformin, semaglutide, atorvastatin, and he also takes a multivitamin. He has no known drug allergies. His vitals are as follows: a temperature of 38.4 degrees C, so he's feverish, heart rate of 88, so he's tachycardic to actually, no, he's not tachycardic. His respiratory rate is 24, so he's tachypnic, and his O2 sat is sitting at 95% on room air, with a blood pressure of 138 over 86. So, as stated before, he suffers from hypertension. Labs of note, he has a glucose of 178 and hemoglobin A1C of 7.0, so his diabetes isn't being well controlled. CBC is normal aside from his hematocrit at 29%. And as for his kidney function, he has a calculated creatinine clearance at 154, an eGFR of 78.3, serum creatinine of 1.02, and a BUN of 27. Microbiology, as previously stated, he was positive for influenza A and SARS-CoV-2. And socially, he works as a programmer, lives with his spouse and his 2 children. Let's see here. Now for his assessment, uh, as stated earlier, he lives with his spouse and 2 children. One of his children had a recent upper respiratory disease, similar symptoms to this. Uh, let's see here. As previously stated, he also tested positive for COVID-19 influenza A, but due to his lack of chest pain, shortness of breath, and his O2 sat sitting at 95%, his COVID-19 infection can be classified as mild to moderate, as defined by the IDSA.
Mhm.
I assess this patient as having an acute mild to moderate COVID-19 infection with a concurrent influenza A infection.
Okay.
I believe our short-term goals for this patient are to replenish his fluids, get him to rest up, control his fever, control his cough to help with those symptoms, so supportive care, and do anything possible to shorten the duration of this current viral infection. Let's see here. Now, under normal circumstances for Mr. Jenkins, we wouldn't recommend flu antivirals. He's outside of that 2-day window for those to be effective. However, he has comorbidities, including but not limited to his type 2 diabetes, his hypertension, and his obesity. So it would be in his best interest for him to receive some sort of flu antiviral. This is supported by CDC influenza guidelines. We have a couple options. We could try zanamivir or oseltamivir. For the zanamivir, I'm hesitant to try that. I know there's a side effect for respiratory distress. He's already suffering from COVID-19. I don't want to pull that thread.
Right.
So I'd recommend oseltamivir for that situation. In addition to that, cough drops or something to help control that cough so you can rest up. And let's see here. As stated earlier, his creatinine clearance was at 157 milliliters per minute. That means he can safely take oseltamivir. And for the COVID-19, he's within the 5-day window for that. I'd recommend he take Paxlovid. It's been effective. It's supported by practice and guidelines, so it seems like a no-brainer on that one. Let's see here. And then, yeah, so my recommendations, I want him to start Paxlovid 300, 100 milligram dose by mouth twice daily for 5 days. I also want to hold his atorvastatin due to the CYP3A4 interaction between the Paxlovid and the atorvastatin.
Yeah.
We should also start him on oseltamivir 75 milligram by mouth twice daily for 5 days. Supportive care, fluids, rest, NSAIDs for his myalgia and fevers, and any over-the-counter cough suppressant or cough drop that he prefers. We should monitor for any worsening fever, hypoxia, shortness of breath, and if those occur, we may need to admit him. And I recommend a follow-up at the end of his antiviral treatment to reassess his symptoms and see how he's recovering. Do you have any questions for me?
So I saw that remdesivir was like just a 3-day treatment. Why would we want to use that?
Let's see here. I believe I actually made a note of the remdesivir, but yeah. So for the remdesivir, that's an IV drug, and I don't trust the average patient to administer an IV drug at home safely.
Okay.
A lot of things could go wrong with that. Awesome. All right, so let me just end this.
Yeah, he would